The First Lady, Dr. Jill Biden, will soon be on her way back to the White House after spending the afternoon here in New Orleans. She thanked the many doctors at the Louisiana Cancer Research Center for their hard work. Meg Ferris spent the afternoon covering the First Lady's visit, and she's joining us live now with all the details. Meg?
That's right, Katie. And Dr. Biden is the ambassador of the Cancer Moonshot, and its goal is to bring cutting-edge treatment to the real world of oncology, and then to take all those new discoveries and to get people access to those and the treatment. Now, the LCRC right here on Tulane Avenue, something going on here is what caught Washington's eye.
Standing all by yourself.
And they told me
Friday's visit from the First Lady was earned because of the innovative special programs created right here at the Louisiana Cancer Research Center.
Cancer changes everyone it touches, and in some ways, we all know this, it touches us all. This community knows that more than most. So many families here in Louisiana have lost loved ones to this disease. And I know that's probably why many of you are here and why you do the work you do.
The National Cancer Institute and the White House became aware of how doctors and nurses with the LSU Health Scott Cancer Center were able to give more and more cancer patients access to cutting-edge clinical trials. Years ago, they grew cancer research from one site to 50 by bringing in other hospitals. And more recently, another idea came from telemedicine, how specialist physicians diagnose and treat patients who don't live near big medical centers.
So what we did in our program called Virtual Research Nurse is we flipped it around. And instead of bringing the doctors were already, the oncologists were already in their practices, but they did not have the nurse. So we're now bringing the nurse virtually to those sites.
That proved to be a gold mine during COVID lockdowns. Patients kept enrolling here when enrollment went down in other states. The Al Copeland Foundation was instrumental in getting the virtual research nurse program going with funding. He watched this cancer center in 2.5 years with clinical trials find a successful treatment for the same cancer that took his father's life. He understands what cancer patients face.
they have three things they have to consider. One is where is the latest and greatest care? How do I get there? And do I have enough money to do it? And when I think about this virtual nurse program, it checks all those boxes.
We still have a lot of patients that don't have access, and so we need to continue to expand. We haven't reached the goal we'd like to reach.
Now, the director of clinical trials at the National Cancer Institute was also here, and here's what they want to do. They want to take that virtual nurse program, and they want to enroll people in 3 other sites around Louisiana and Mississippi and test and see how well it does. And if it does well, and I'm told that they were very impressed today, then they want to roll this out across the United States, something that was born right here at this cancer center. Reporting live from the LCRC, Meg Ferris, Eyewitness News.